Okay, wanted to do an intro on the stockroom itself. We've had some confusion on how things are set up, as well as how to build IV start kits and C-spine start kits. Let's go through the room first off. Basically the way the room's set up is most of the things you would need for restock are going to be kind of on these lower shelves, and there's kind of a segregation of things here. So you've got an IV area here. This is going to be all your IV setup. You've got saline, tubing. This is all the stuff to build IV start kits. We'll go through that here in a little bit. As you get kind of down here, this turns a little more into bandaging and splinting, and then you've got hot and cold packs down there. As we come down this way, this is IV EKG kind of area down this way. And then up here is going to be medication, drugs, all that kind of stuff, syringes. Those syringes do continue kind of across this top. That's one of the few areas you might want to get into the top area. And then you've got alcohol, iodine. You've got some assessment type things kind of starting in here. So you've got trauma shears that actually be up in here. This area right here is going to have your pen lights, that type of thing. As you work your way back this way, this gets into some of the capnography and CPAP type devices here. This is going to be some of our IO needles if you have to restock those. Over here is going to be more BSI type stuff. So you've got gloves, your gowns, your biohazard trash bags, masks, that type of thing here. And then here's going to be kind of an oxygen airway area. So you've got most of your adult masks and that kind of thing are here. Please pay attention when you're grabbing these things that you're grabbing, adult versus pediatric. We pretty much have adult on the top and pediatric kind of across the bottom, but pay attention to that. You do have oral airways, nasal airways, that kind of thing throughout this area. And then down here is going to be your ET tubes. We do have this kind of black thing here that has them all sized out, so they're all kept in individual tubes based upon size. And then you got some suction device type materials down here, some excess laryngoscope blades for the old disposables. And then this area is going to be kind of your vomit basins, urinals, things like that. Some more suction type devices kind of carry into this area. And then right here you've got some of your stuff for C-spine and your towels and blankets and that kind of thing. The top shelf is pretty much reserved for additional stock. So when you're working through any of these areas, these bins and that kind of thing, if you run out of these items, in most cases I've tried to keep the extra stock straight above wherever it is on the top shelf. So look to the top shelf for additional items before you write them on the list. If you can't find those additional items, please do write them on the list at the front, near the front door, so that I know that we need to reorder those. Sometimes they're on the top shelf, sometimes when they won't fit on the top shelf, like in this case with the bandaging, I've got most of the IV stuff on the top shelf, so the bandaging stuff's actually kind of opposite side. So you may have to kind of look around on the top shelves to find additional equipment. Same thing over there, some of the IV supplies kind of carry over to that area as well. There is an extra storage area. If you go around the corner underneath the stairs, there's some more overstock back there as well. So that's kind of general stockroom type of things. Please be mindful to rotate stock. You know, if you're getting medications, please always try to pull the oldest date first. Don't just grab the first one you see. Let's try to get the oldest equipment into the ambulance so that way it has that chance of getting used before it expires. As far as building kits, let's go ahead and start with the IV start kit. There are several kind of items that go in here, and I've got a few different ways to remind you in case you're having a hard time remembering. First off, there is an example of every item that needs to be in there, as well as kind of a write-up here. The other thing we've done is everything that needs to be an IV start kit has one of these little red asterisks kind of on the label next to it. If you notice, there's little red asterisks. What you're going to want to do to start this is you're going to start out with a specimen bag. These are kind of up here in this corner. Sometimes they come in these other Ziploc bags, so pull one of these out. So one specimen bag for an IV start kit. And then the way I've always kind of remembered it is it's everything on the bottom shelf and then the two edges of the top shelf. So if you just start here on this edge and then work your down and up, so like a big U, you'll end up getting everything. So you're going to have one saline flush. I usually order 10 cc saline flushes. Sometimes we'll have like a 3 or 5 cc saline flush. You're going to have one IV start pack, one buff cap tubing goes in there, and then you're going to have one of each blood tube. One of the things we tend to do with the blood tubes is we're going to take all the blood tubes and we're going to rubber band them together. There's usually rubber bands sitting here. And the preference on this is actually done improperly, the rubber band across the middle. The preference is to stack all the tubes up with the bottoms together, and then the rubber band should be towards the bottom. The reason we do this, and the idea behind it, some of us like it, or, like the rubber band. Some of us will just rip it off and use it without. But the idea behind it is when you go to do your blood draw, you can just take and stick these in like this and kind of do a one-handed rotate and twist method. So you can see you can rotate, twist, stick them in, rotate, twist, stick them in. And you can pretty much do that one-handed, so long as that rubber band's on the bottom and they're all stacked up like this. If the rubber band's way up towards the top, then you got to roll that rubber band down to make that work. So that's the idea behind that. So you're going to basically throw one of these little bundles with the rubber band in there. So that's each of the blood tubes. Then you're going to have this vacutainer barrel and hub. So that's going to be this one and then that top piece. These two go together, as you know, for blood collection. So make sure each of those goes in there. Once everything's in there, please seal it up so that things don't fall out, and then that's ready to go into an ambulance. So that's an IV start kit. You can also put completed IV start kits up here if you want to come back here and build some extra. Sometimes people like you saving them time by building that. So that's an IV start kit. Let's go into C-spine kits and how we want those built and built properly. The things you're going to need for this kit is you're going to need a patient valuables bag to store everything in. You're going to need one adult C-collar, which are going to be here. Please be mindful the pediatric C-collars are here. I did put this on here to try to, keep people from grabbing the wrong collar. But those are the pediatrics. These are the adults over here. You're going to need one set of spider straps. You're going to need 4 towels total. I'm going to go ahead and just do 2 now because I already pre-rolled 1 towel, but keep in mind each roll is 2 towels, so there's 4 towels total per kit. And then on this side right here, you're going to need 1 preferably thicker or newer roll of 2-inch cloth tape. Okay, the way we're going to build our kit, first off, let's start with the towel rolls. You want them to look about like this when you're done. The way you build that, can you keep me in frame? Okay. The way we're going to build that, when these come from the hospital, which is where they usually we're getting them from, they come tri-folded. So you'll notice that they're tri-folded. That actually creates a little bit too short of a roll. So we actually want you to unfold them vertically and then just bifold them. So just fold it in half. Okay? So you're going to do that with both of them. You're going to fold them in half lengthwise. So there's the first one. Do that again with the other one. So fold them in half lengthwise. And then what I tend to do is just lay them on top of each other. And I tend to stagger them a little bit. You'll see why when we get to the end. But I tend to stagger them with the bottom one coming out more on this side, so that when I roll it up, you don't have that big, thick transition. So we're going to start on this end and just kind of roll it up. Fairly snug roll. Doesn't have to be super tight, but you want it to be fairly tight, fairly straight. And you should have a nice transition. There shouldn't be a large lump right here. If both those two are stacked on top of each other, you may get that lump. You're going to take your tape, and you're going to wrap kind of each edge. And just one wrap around is fine. Okay? And once you've created both of these, so 4 towels total, 2 rolls, take your tape, fold over the edge, because when somebody's messing with this with a gloved hand on the side of the highway leader, they don't want to be fumbling around trying to find the edge of the tape. Give them a nice easy edge to grab so that they've got it later. The idea is to save time when you're on scene. We're trying to keep those 10-minute, scene times, especially on bad trauma. So everything you can do to save time for that person later by doing work now is beneficial. The other thing you want to do, don't just stick this in the bag. You need to take it out of its packaging. We're going to throw the packaging away. Please also note that in the stockroom we have both a trash can and the biohazard trash can. Biohazard trash is extremely expensive to dispose of. The only thing that should be going in biohazard trash is sharps containers that are sealed or blood-soaked, fluid-soaked, vomit-soaked materials. If it's not blood-soaked or some type of bodily fluid soaked, it's not biohazard. If it's just the packaging and things like that that come on IV kits, or even just gloves that didn't get covered in blood, if they're just gloves that you just wore but didn't get anything on them, those deserve to go in the trash. By sticking them in the biohazard, you waste a bunch of Highland money, to be quite honest. Once you pull your C-collar out, we'll get back to this. The C-collar, you're going to flip over the chin piece. These always come packaged with this chin piece flipped like that for easy storage, so they store flat. But this chin piece does need to be flipped over like that. So please flip over the chin piece. Then take your 2 towel rolls, stack them up in here. Take this tape with the folded over piece and put it right here on the end of the Velcro. Okay, that keeps it from rolling around in the bag or potentially getting lost. And then that way you can just kind of pull this out of the bag and there you are. You've got all the things you need for your C-spine. Okay, the spider straps are also going to go in the bag, so you basically have these two things going in the bag. Please make sure the spider straps look nice and well bundled like this. Spider straps, when you go to redo them, you know, you're going to have this tangled mess when you first get them back from the hospital. If you think it needs to be washed, the proper method for washing spider straps is a bucket of soapy water. You can maybe add just a little bit of bleach to that. This is actually inappropriate the way somebody just did this, the way this was rolled up like that. That's going to cause too much problems for undoing it later. I'll show you how to properly fold this. But if you do need to wash them, bucket of soapy water, let them soak in there for quite a while. Use a gloved hand, especially if they're really bloody, you know, and make sure all that stuff's kind of gotten out of them. You can use a little bit of laundry soap if you want, but do not machine wash them. When they're done and you feel that they're adequately washed, just hang dry them. What we typically will do is out in the bay, there's that mop sink out there. We'll tend to wash them in a bucket there, and then once they're washed, we just kind of hang them on the little shelf above that sink and let them dry. And it'll take several hours before they're ready to actually be put back together. When you go to put them back together, make sure all of these are folded back over on themselves, so that, you know, there's no tangling and the Velcro's not getting stuck and everything. And then the idea when folding these back together is really just to lay them on top of each other. So you're just going to lay them on top of each other like this, whatever seems to kind of make the most sense. When you run into a thick piece of strap like that, just lay it down like this. Don't roll it up or anything weird. Because keep in mind, we want this to be able to come apart easily later. So we want to be able to just undo the strap and have it come apart. So we're just going to fold each of these over on top of each other. Same thing here. Some of these will come with a strap like this that you can use. Some of them won't. If they don't have this strap, what you can do is just take one of these, undo it, and then use that as your strap. So you're just going to wrap it with the Velcro here. What you'll find is when you get about halfway around, you're going to have to twist and flip it over so that the Velcro can stick, and you can use that as well. This would be acceptable. So this or the use of a strap that's already pre-attached, either are fine. You're going to put this in the bag. This piece goes in the bag, and that is a completed C-spine kit. All right? If you have any questions, please feel free to ask me or any of the officers, and that's it for this video.